So I would like to welcome everyone to our first webinar in a series of webinars um, that is part of a project that is funded by the RRF Foundation for Aging. My name is Joel Anderson. I'm a professor in the College of Nursing at the University of Tennessee, Knoxville, and I'm the lead investigator on this study, which is a partnership with the University of Nevada, Las Vegas School of Public Health and Savvy Systems, which is the creator of the Savvy Caregiver program. And we've created this webinar series in collaboration with one of our community partners, the Carolina Aging Alliance. Carolina Aging Alliance serves folks, LGBTQ older adults in the Piedmont of North Carolina. And for more information about Carolina Aging Alliance, you can go to www.carolinaaging.org. And our Savvy Caregiver with Pride study that I mentioned to you that is sponsoring and hosting this webinar, if you'd like more information about that study, you can email us at savvy, SAVVY, at utk.edu. And so I'm going to turn it over to Heather Burkhart, who is a board member of the Carolina Aging Alliance along with me, and she's going to be moderating our webinar today.
Thanks, Joel. I appreciate it, and welcome everybody to this conversation. And it is a timely one. If you didn't know, May is Older Americans Month. And so throughout this month, there are celebrations going on, not just in North Carolina, but across the country. And so it's a great time to really ask the question, what is the Older Americans Act? And how does it apply to me? So hopefully today, through our panelists, you'll get a little bit of more information about the Aging Network, about the Older Americans Act and what that looks like in your community. So like Joel said, I am on the Carolina Aging Alliance Board of Directors. I'm also an employee of AARP North Carolina. I'm Associate State Director of Outreach and Advocacy. And we are joined here today by Janisha Hennigan, who is the Area Agency on Aging Director in Durham with Central Pines Council of Governments. And we've got Bob Cleveland, who is our Aging Program Planner at Piedmont Triad Council of Governments in Kernersville, North Carolina. So they are going to be our experts here today, and we will also have time to answer questions through the Q&A function at the bottom of your screen. So we will have chance at the end. So I'll ask them some questions, and then once I'm done asking all the questions, we'll let you chime in as well, because we want to make sure you get the information you need today. But for those who don't know, the Older Americans Act was really created in 1965. So this is a federal legislation that's been around for a long time. And we know that research tells us that most people really want to age in place. They want to stay in the communities as much as possible. So, Janisha, I'm going to start out with you. Can you tell us what the Older Americans Act is exactly and how maybe it helps people age in place?
Sure. And as Heather mentioned, the Older Americans Act was passed in 1965, just kind of giving a framework of how to help give services to older adults that were here in the United States. And so one of the ways with Aging in Place, I like to think of the Older Americans Act as providing those community-based services to help address some of the needs like our daily needs of living. And then some may have heard of like social determinants of health or those social drivers of health. The Older Americans Act can help address some of those needs. So you think about your home delivered meals or congregate meal programs when we think about addressing like food security for older adults. There's also like in-home support services. So if you have a loved one who needs help with, bathing, dressing, what we call those activities of daily living, there's transportation services, medical to get to grocery stores or to social activities. There's caregiver support. The family caregivers are providing assistance, so there's support for them in the Older Americans Act. There's also health promotion programs. I think it's important that we address things in a preventive way for older adults. So those chronic diseases, management programs, fall prevention, those things, we can find those programs under the OA as well. And then we have our ombudsman program, which probably be talked about later. And then just information that an individual may need, what's available and services that are in their community. And all of those things combined together gives a person a choice, some availability of options of services that if they want a choice of their community to age in place, how that community looks, whether it's in their home, the home of a loved one, or within a facility, a place of choice, place of their community. These services are there to help support that.
Thanks, Janisha. I've got a question. You listed off a lot of programs, different things from Meals on Wheels to in-home aid and things like that. Is there typically a income requirement, or do people have to pay? I'm just thinking if I'm sitting listening and these sound great and I might be interested, would I be eligible? Do I have to worry about my income?
No income requirement, just age requirement. Making sure you're 65 and older, but no income requirement. Grant funded programs that come from our federal level to our state unit on aging, and then come to our area agencies on aging. And within those area agency on aging, we all work with our local providers, however that may be divided between regions and counties. We work with making sure those services go there.
Thanks so much, Janisha. And Bob, I'm going to ask you, Janisha did a really great job laying out different types of services in the community that help people who live in their home or live in the home of a family member or friend. What about people who are residential living, like an assisted living or a nursing home? Are there any part of the Older Americans Act that reaches them or that might impact them or benefit them?
Absolutely. Yeah, the Older Americans Act was meant for any older adult. So that includes, of course, the primary focus is keeping people at home in the community where they want to live. But we know there are a number of people who live in those institutional settings, like an assisted living or a nursing home. So actually back in 1978, after the act was established, every few years they amend the act, they update the act, add a few different things. So 1978 is when they established the long-term care ombudsman program. It's a Swedish word, ombudsman. It means advocate. And that's exactly what they do. So they go into assisted living and long-term care facilities to advocate for those residents. So they listen to their concerns. Every nursing home has a resident's Bill of Rights. And that Bill of Rights says this resident has the ability to, number one, make sure that this is where they live. And because it's where they live, they can have their mail unopened. If there's a room change, they have to be notified ahead of time. So there are certain protections that they have. So residents, because they're often by themselves, they may not have family member to speak up for them. The ombudsmen speak up for the residents. So they're not the police. They're not going to go in there and fine a facility. Now, if they find something egregious, they can bring in the people that would do that. But that's not their role. Their role is to be that advocate for the resident to make sure that their voice is heard. For example, if someone says, I keep leaving my call light on, but it takes 30 minutes for them to get there. And it keeps happening over and over and over again. Well, the ombudsman can meet with the resident, meet with the family, and then meet with the facility. The ombudsman also do training in facilities to make sure that they understand the rights and protections of older adults that live with them. And again, those same protections are available to people who live in assisted living communities.
Great. Thank you for that. There's just no matter what your service need or long-term services and supports needs are, it seems that there's something that's touching from the Older Americans Act. Janisha, you had mentioned the Family Caregiver Support Program, and we know that a lot of folks in the LGBTQ community, the word family means something different, and it may not be a marriage, it may not be blood family. Folks are working with their network of friends and chosen family. How can they participate in the Family Caregiver Support Program? Is that a barrier for folks in the community?
No, it should not be. The family caregiver support, even though the word family, and we know people define family differently, but when we look at for the family caregiver support program, it's a family member or any other informal caregiver. As long as they're 18 and older, and they can provide they're providing care for someone who's 60 or older, or those who may have a cognitive like Alzheimer's disease or any other or related disorder. And I think it provides that definition to identify that a caregiver family could be in all shapes and forms, whether it be a spouse, a sibling, or a friend who's stepped in to help. And I think we've all seen that in our community. So I think not having the bounds of what sometimes society puts as traditional, what a family is, this program can make it available for those who qualify for the
Yeah, and that's
program.
written in the law, right?
Yeah.
It's not defined as family. So I think that's really good news
Yeah.
to hear. What services, other services are part of that family caregiver program? What do those look like for caregivers? What can
And
they
so
receive support with?
there's services to want to give information. A lot of our family caregivers, like, it's like, where are the resources? So there's giving access to what resources are out there. There's also what we call respite. Sometimes the burden, and we know the unpaid caregiving hours, sometimes family members just need a little time to just have a moment for themselves. And so there's the respite option for that. There are supplemental services. So if there's just needs for maybe in-home kind of modifications or medical supplies, maybe some things like that, the program can help with that. But also, it's also great to have a network of people that you can relate to. So there's like, counseling and support groups as well, to let caregivers know that they're not in this alone. Sometimes it can be an being isolated situation, thinking you're the only one taking care of your family member, but there's support out there. And so that's one good thing about the program of offering that.
I think that's terrific. Sometimes we, don't think about the important role that caregivers play, and they often, get focused on the care recipient. But, to be able to be a good caregiver and to do it well, um, you need to take care of yourself and get some services to make it easier. So that's great to hear. Um, Bob and Janisha, you both work at area agencies on aging. Bob, can you tell us a little bit about what an area agency on aging is? And the Older American Act created what's known as the Aging Network. What is this Aging Network and how do people get plugged into it?
Sure. Well, actually, I'll start kind of with the aging network first because
Yeah.
the agencies fit within that network. So again, under the Older Americans Act, this created this aging network, and it said, from the federal government Administration on Aging, which was the first entity in the federal government established. And I'll say very quickly, it's interesting that the Aging Network is the only entity in the federal government that has an advocacy charge for the people that work in that field. So again, if you look across other departments, I'm not disparaging them, but just saying they don't have the purpose or the mission to advocate for their residents. We do in the aging field. So, and again, that was set up under the Older Americans Act. So with that, again, federal AOA, then they established state units on aging. So every state has a state unit on aging that receives programs and services from the federal government. And then that state unit gives those dollars and services out to the area agencies on aging. In North Carolina, we do things a little bit different than some other states. But again, these services are packaged, flow down to the area agency, and then each area agency has within its catchment area a certain number of counties that it serves. And we give those dollars and services to the counties and let them make the decision about what's right for their county. So we also then have the local level, and that local level is our service providers. So these are the people providing transportation, in-home aid, adult daycare, information and referral, family caregiver services, all the different services. So there's a network from the ground level, the local level, all the way up to the federal government. And actually back in 2012, I believe, when they established ACL, the Administration for Community Living, they took the aging network and combined it with the disability network because they said that disability didn't have a network. They're very good advocates, but they can learn from the aging network how to be connected. And so again, that was a very important piece of having this network, this stream of funding and services connecting from the federal government all the way down to the local level. So as far as area agencies go, our role, our mission, our purpose is to make sure there's a streamlined, connected service delivery system in our region. So in North Carolina, I'll just mention North Carolina, we have 16 area agencies on aging. If you've seen one area agency, you've seen one area agency. They're not all alike, even though they're all housed in North Carolina within councils of government. I actually worked for an area agency in Illinois for 15 years where that was a nonprofit organization. So I believe there's 600 some odd area agencies all across the country. Every state that you go into, you will find an area agency on aging. But that's, again, going to be that closer to the ground regional delivery system, really looking at quality assurance, making sure that the local providers are delivering service according to standards and say that this is what a meal should look like. This is what a ride should look like. And making sure that the people who are getting the services are, number one, older adults, but also making sure that they're receiving a quality service. So that's something the area agencies on aging do. Again, we look at other innovative quality programs, like evidence-based programs, things that help people have better health and education around how to live better with chronic conditions, diabetes, chronic pain, fall prevention. So there's a lot of things that we're trying to help older adults be healthier and remain in the community with these programs and services.
That's great and so helpful, Bob, to kind of hear how it looks at the local level and the regional level, and that you're not going to necessarily always go to a government agency to get the services through the Older Americans Act. It could be nonprofit organizations, it could be a senior center, and it's going to look differently. So, but yet all of those providers are getting funded from that Federal Older Americans Act. And I saw the question in the chat about funding. So we're going to get to that at the end of it, but we want to get through a few more questions because there definitely is some news to share there. You know, we know that the LGBTQ older adults are often face unique challenges related to health and social support and isolation, higher rates of mental and physical issues. Joel, can you talk a little bit about how the Older Americans Act affects LGBTQ older adults and what's in there for them?
Sure, I'm happy to. So listening to Janisa and Bob talk, we've already been talking about a lot of personalized programs and programs that are available to anyone regardless of what their family looks like and regardless of income. That's very important to LGBTQ older adults, as you mentioned, Heather. LGBTQ folks in the country are more likely to experience health disparities related to physical and mental health, particularly among the older adult population in the LGBTQ community. LGBTQ older adults are also more likely to age alone. They may not have those typical traditional family supports and caregiver supports. They also may not have the insurance coverage and the income that might be required to engage caregiver services and for-profit and paid services. So the services that are provided through the Older Americans Act and through the area agencies on aging and the aging network are really vital to older LGBTQI plus adults. When the Older Americans Act was reauthorized in 2020, a requirement was added to that reauthorization that area agencies on aging had to assess the needs of and engage with the LGBTQ older adult population. Now, many area agencies on aging across the country were already doing that, but this was the first time that it was a requirement of the reauthorization. And at that time, I was part of the Area Agency on Aging's Executive Council in Knox County, where the University of Tennessee is located. And we were also doing our needs assessment, our regular needs assessment that year. So that was the first time that we had sort of the mandate and the evidence and the backing to be able to add questions around sexual orientation and gender identity for the first time, because we had to. And it gave us some really useful and interesting information to help steer the programs and the services that were being provided by the Area Agency on Aging there in Knox County and in Knoxville. So that's really important information to have if you're going to be working with a group of individuals that you know are experiencing some, as you said, unique needs related to cultural and society and also legislative and policy issues. As sort of a spoiler and kind of tying into the question that we already have in the Q&A, the Older Americans Act was up for reauthorization last year in 2024. It has not been fully reauthorized yet. And so given all of the things that we've been seeing over the last few months, my concern is that that stipulation requiring engagement with the LGBTQ older adult population may be removed and may not be there, and in some ways may actually be made impossible to do for various reasons. So I think it's really important for us to be having this conversation, not only just to inform everybody about what this important legislation does and how these services really do provide a wonderful foundation for our community, regardless of who you are, but how they're really important to minoritized and marginalized populations as we move forward in a time of economic instability and a time when the older adult population is growing and the needs of that population continue to need to be met.
Well said, Joel. Well said. And I'll add, in addition to the outreach expectation to the community, also rural elders, low income elders, African American are also in the law as it's written right now. And so, although the question we'll get to is around the funding, I think it's really important to elevate and highlight with the language in the current law. Um, and if it is reauthorized, that language can change. And so usually every time there is a reauthorization, there are language changes and program changes, things like that. So really, really important to mention. So thank you for that, Joel. Um, Janisha, if you were giving guidance to somebody about how to get more information on these services in their community, where would you point them? What would be the starting point?
Well, definitely you can always call one of the area agency on aging in your area. But also like how Bob, he was telling about the agent network. You've seen one area agency on aging, you've seen one, and then how funding comes down to our local providers in those counties and what is provided in those counties is determined by those counties. So every county can look a little different for what those are provided. But when someone calls here at Central Pines, we try to stay connected, of course, with our local providers that receive funding from us, from the Older Americans Act, but we also build relationships with other entities that may serve older adults, because we know when it comes to meeting the needs of older adults, as we may talk about funding, sometimes our funding may not stretch as far, but there may be other nonprofits or community organizations that can help fill the gap as well. So we always ask what county an individual lives in. We try to connect them with our providers who may provide the services, but if not, we look, like I said, with other trusted partners within that area to get those services that they need.
Fantastic. Yeah, Bob, let's add to it.
I was just gonna say, I'd like to add to that. So, yeah, Janice made a great point. With these, if you were to call the state is gonna say, call your area agency on aging, here's the number. So they also try to get people back to the closest to the local level as they can. And so, Janisha was exactly right that not only will we connect people to the Older American Act service, there are plenty of other services people know about, of course, food stamps, Medicaid, energy assistance, weatherization, all kinds of different programs, including veteran services. So again, it's not just one set of older adults that we're looking at. We're looking at all older adults. And again, if someone can get VA services, well, that may mean somebody else can get the block grant services or the aging services. So I always try to get them to the best source of support for them.
I think that's so important, Bob. So thanks for adding that. One thing we know is the Older Americans Act provides funding for just a portion of the services, and that funding really hasn't grown a whole lot over these decades. It hasn't certainly grown as exponentially as the population over 60 who receive services, and so it hasn't kept pace. And so in some communities there are waiting lists, and to be able to provide that navigation for people through through all of these different possibilities is really important. So the role that area agencies on aging play in that navigation and information and referral is critical. Um, as people are hearing maybe some of this for the first time, what maybe is available in the community, maybe they're thinking they're in a crisis now. I know I've talked to a lot of people over the years who they only pick up the phone when they're in a crisis, right? They haven't done a lot of pre-planning. They haven't thought about um, themselves as a caregiver and maybe need things. But what would sort of, and anybody chime in here, what would your advice be or guidance for someone um, who's listening to this webinar, who's considering exploring aging services in the community? What do they need to be thinking about? What's the best thing for them to do?
Start early. Truly, the earlier you start, the better. And the reason I say that is, as you said, Heather, aging services have been fairly flat funded over the years. So we know that we've seen this incredible boom in the aging population. Right now, the fastest growing population is women 85 plus. That is the biggest population in our country. That's incredible to think about. And so that's the prime area where people really start needing supports. The problem is we don't have enough funding. So we do have, for many services, waiting lists. I know in several of our counties, people have been waiting 3 or 4 years for in-home aid services. That's unconscionable, in my opinion. Anybody who needs in-home support cannot afford to wait that long. And so I do think some people are, when I say plan ahead, is if you're thinking down the road in a few years, you're going to need that support, it's not a bad idea to call and get on a waiting list now. Talk to a lot of states have options counseling programs where the whole purpose of that program is to sit down with someone and talk about, number one, their wishes. It's not the professional sitting behind the desk that's going to tell you what to do. It's going to say, this is what I want. I want to stay in my home. I don't want to be a burden to my kids. I'll go to a nursing home. I want this, I want that. And then you set up a plan. Okay, well, how are you going to make that happen? Do you have to possibly use reverse mortgage to pay for care if you want to stay in the home, if there's not aging services? What might be available to you during that planning phase to really help you set the future for where you want to be and what you might want to be able to accomplish.
Thanks, Bob.
Can I add as well, Heather? I do the planning ahead, planning early. One thing here, we also try to reach those who are not necessarily eligible for receiving services now, to start the education really early. So even if it's a different group of generation, Gen X or millennials, thinking about their parents, thinking about their grandparents, but also thinking about themselves, because we're an aging society. So no matter where you are in the lifespan, you want to make sure that you're planning ahead. And we also know, we think about caregivers, a lot of, certain, millennials or whatever, are taking care of family members within their home as well. So making sure everyone across all generations have information about what services we offer.
Great, thanks.
And
I've
Heather,
got a
may I
couple.
add, to that point, just
Yeah.
tack on and emphasize that, as Bob was saying and Janisha was saying, your area agency on aging, they have their finger on the pulse of all the services that are available in the area for older adults and services that are available for people across the life course. I learned so much when I was on the executive council for the Knox County Office on Aging, and just marveled at the amount of information that they have at their fingertips.
That's great. Let me ask it for somebody who maybe is a little concerned about reaching out for formal services with a healthcare provider or another funded agency for the Older Americans Act. Are some of these providers receiving training or awareness about the unique needs of the LGBT plus community? Are there any affirming service providers, things of that nature?
I'll jump in and say yes. I know our ombudsman actually lead that training here at our area agency on aging. So they will go into communities to lead training for LGBTQ. I apologize, I don't have all my initials, but certainly to provide information, provide I'm not gonna say direction, but provide support for people who are marginalized, for people who are struggling because of their orientation, which should not be an issue. But again, it is important to help the service providers get training on how do I work with someone who is maybe different from me. We always have that challenge because we always have people who are different from us. But still, how do you be sensitive? How do you be not afraid to ask questions that you need answers to so you can direct them to the right place?
And Heather, that kind of touches on something that we've touched on a bit when Janicia was saying that sometimes the services that are available by the area agency on aging are affected by state and local laws and policies, and that can also have an impact on marginalized communities like the LGBTQ community. That says, so that to me is why having those provisions in the Older Americans Act are so important, because it has the requirement at the federal level. And so SAGE, Services and Advocacy for LGBTQ Elders, provides training that a lot of different care providers at area agencies on aging take part of, called SAGE Cares, that helps with that cultural congruent
Competency.
care.
Yeah, I think absolutely. So that would be something that folks could ask an agency if if they participated in that, or
Mhm.
if they needed reassurance. Great. I appreciate that, guys. I am going to get to our questions in the chat. So our first question was, are any of the services provided under the Act in danger of being reduced? And I've got a little bit of numbers here, but you guys, you might have something more that has changed. But in the proposal, the budget proposal from the president for FY26, there were a lot of changes around that in terms of, and that's the regular budgeting process that the federal government does. The Older Americans Act is in the pot of money they get is discretionary non-defense money. So if you know anything about the federal budget, it falls in the non-defense discretionary pot. But the recommendations in that budget proposal was, we talked about the administration for community living, that it would be dissolved, and these programs would be administered by the Centers for Medicare and Medicaid Services. So CMS, if you're familiar with that, CMS does Medicaid and Medicare. So it would take the administrative responsibility to CMS and eliminate particular services, including health promotion, elimination of the falls prevention program, elimination of the lifespan respite program, and it really slashes the ombudsman program down to $5 million nationally. And then the other programs would receive level funding. So that was the president's budget proposal, which is pretty severe in a lot of ways. And so this is the time that folks are advocating. There's a lot of work going on because that's the governor, or this president's proposals. It still has to go through the House and the Senate. And there a lot of work is being done in terms of advocacy space. So there are definitely opportunities to let your voice be heard, to contact members of Congress, your House, your Senate members. If you're receiving these services, it's really important that you let people know. But this is a really critical time, and I would love for any of you guys to chime in or add to that.
Yeah, I apologize. I'm just going to jump in. I've been around the Aging Network for over 30 years, and I would say I've never seen a time like this where aging services has been, for lack of a better term, under attack. I don't think our legislators understand the value and the importance of these community-based services. If I may, I'm going to tell a very quick story. This is a story that happened in Greensboro, North Carolina. There was a woman, she had 4 different chronic conditions. She had a heart issue, she had COPD, she had diabetes, and maybe arthritis was the 4th one. But in 1 year's time, she made over 130 trips to the ER. Again, true story. It happened at Cone Health Hospital in Greensboro. I talked with one of the doctors who was part of this. So after a year, there's 4 doctors who were reviewing this case and going, oh my gosh, what is going on with this woman? So they send a nurse case manager to the home. She gets to the home and finds out she has no electricity. And even if she had electricity, she did not have a working refrigerator. So what couldn't she keep cold? Her insulin. Now, it wasn't so much the food, it was her insulin. So every couple of days, she's going into diabetic shock. They send her to the ER, they fix her up, and where do they send her? Right back home where it's not working for her. So she's back every few days. So the doctors group on their own took money out of their pockets. They paid for the refrigerator to be replaced. They paid her utility bill, stocked her with food, and they paid that nurse case manager going to do a little education with her. In the years since they did those interventions, take a guess at how many ER visits she had in that next year. Anybody? Take a guess.
0.
You're right. It was none. So the point of all this is the services, if she had had maybe some home delivered meals, if she had something that could have paid for that refrigerator to be replaced, that's at a far less cost than 130 ER visits at a cost of probably around a couple $100,000. I could have bought a lot of meals for people. And so my whole point of all this, and I think Janisha mentioned it earlier, social determinants of health, is these services are not only just something nice to do, they're actually impactful, and they do save people. They save their lives. We know there are cases where home delivered meal drivers are out on a route and they find a person who's lying on the floor in their house. They call a family, they get someone there, they've saved their life. So it's really important to keeping people healthier, more well-rounded, keep their well-being up, than just, hey, we're doing something nice for older people. So impactful story. And I do tell that to legislators and try to wake them up to this fact that it doesn't make sense to slash aging programs because we're just going to increase the Medicaid budget when we're putting them in hospitals and nursing homes. Thank you for your indulgence.
It's a great story. I mean, it just really shows the impact. And um, I think that prevention piece is really critical that Janisha meant. You know, we go upstream and provide low cost services that have high impact and really sustain somebody's health for a longer period and reduces long-term healthcare costs.
And I appreciate the story, Bob, because one of the things that I've found when I'm talking to the community or anybody, data make us credible, but stories make us memorable. Legislators and policymakers are probably inundated with data all the time and are trying to make sense of it or maybe not wanting to make sense of it. Stories sometimes help cut through the noise and give meaning to those data points. It's just throwing that out there as a little communication engagement tip. And also, so many of these programs are evidence-based. There's research to support why these programs are useful and good and work and change things. So they're not just nice things to do. They're really positive, useful things that address those social drivers of health and have research to back them up.
Really important, Joel, to mention. I'll also mention older adults vote at higher rates than other people. So, you know, the more we can tell stories or show the impact for constituents who are voting and have a strong voting record, you know, it's always good to mention that. So, are there any other questions? There's nothing in the Q&A box now, but feel free to add something if you're interested. We've got some real experts here and we want to make sure you get all your questions answered. Going once, twice. Well, I am really grateful for all the attendees here to come and listen and learn more about this important federal legislation, the Older Americans Act. It couldn't be more timely for a lot of reasons. And hopefully you've learned something new, something that can help yourself or a loved one, and also maybe sparked you to do some advocacy Joel, I'll turn it over to you if you want to just wrap it up or tell people what to expect after the webinar.
Absolutely. And I want to thank you, Heather, for moderating our panel today, and to Bob and Janisha for their expertise and the work that they do every day to support our communities and to support older adults. So we will be following up to all the registrants with an email that will have some attachments and links to resources, some of which have been mentioned today, some from AARP, so that you have some good information in your hands to use as you will, whether it's for advocacy or education purposes. We'll also have a short little survey to find out how we did, what you liked, and what other topics you might want to see in a future webinar. Looks like, oh, it's a thank you. Thanks, Julia. And you'll also have the email address then if you're interested in the Savvy Caregiver with Pride study. You'll be able to contact us and get some more information about that study. And we'll also have a link to our community partner, the Carolina Aging Alliance, so that you can get more information about them as well. And so thanks everybody for this. This webinar was recorded, and so we're gonna give you information about where we'll be posting that recording so that you can come back to it and listen to it or share it with other folks. And our next webinar will be in August, and it will be about advanced care planning. And as soon as we have those dates, we'll get that information out to you. So with that, I'm going to stop the recording and appreciate everybody's attendance today.